Hi guys, it's Paula with You Restored. I wanted to take a couple minutes just to talk about microneedling and getting ready for that procedure. I wanted to do it today because I am actually 24 hours out from having a microneedling procedure done myself. You can see that I still have some patchy redness left on my face and my neck where I was microneedled yesterday. This is completely normal, but you can also see that I'm not wearing makeup and I need to be without makeup for a couple days. It's really important when we set up our appointment for microneedling that we think about our social calendar and what we're doing. I always recommend that you consider doing this procedure on a Friday, so that way you have the weekend to kind of have your skin come back to normal and be able to wear makeup or go into work without a red face. Most individuals see that a lot of the redness is gone within 48 hours. So some of the things that you need to know to prepare for this appointment. So besides planning your social calendar, you need to make sure that you've had a conversation with Dr. Ryan. If you are someone who has cold sores, you really should consider taking an antiviral the day before, the day of, and the day after, because this procedure can cause you to have a cold sore come up, and nobody wants to have to deal with that if you can keep from it. The other thing you would need to talk to Dr. Ryan about is if you are on blood thinners. You need to have a conversation with him because ideally you would be off of blood thinners prior to this procedure. So he may want you to do something different or to consider a different method or procedure in general. Another thing that you need to think about is a lot of us are on a vitamin A derivative. This is like your retinols, your retinoids. We need to discontinue using these on our face a week prior to our procedure. Another thing that we need to discontinue a week prior to our procedure is alcohol. Uptaking alcohol during this time period can result in more bleeding and potentially bruising from the procedure. And 2 weeks out from the procedure, you need to make sure that you aren't getting any sun exposure that results in a tan or a sunburn. If something like that happens, then you'll need to reschedule your procedure. The other thing that you would need to consider rescheduling for is if you've had any other cosmetic treatments, such as a wrinkle relaxer treatment or a filler treatment. We need to give your face time a couple weeks prior to microneedling. So these are really the only things that we have to think about prior to our microneedling appointment and making sure that our bodies are prepared for the procedure. There's a couple things you can do around the house too to help prepare yourself. You're going to want to have clean sheets the night that you come back from your microneedling procedure. It's really important that your pillowcase or your sheets, wherever that treatment space is coming in contact with your bedding, that those are clean and fresh to help protect you from any possible skin infections that could occur. So I am excited for your procedure. I hope you're excited for your procedure. I can't wait to see what this procedure does for my face and my skin, helping reduce those fine lines and my melasma pigmentation that I have on my forehead. I look forward to seeing your results.